This is Selma Schimmel at the 33rd Annual San Antonio Breast Cancer Symposium. And we're going to have a discussion now with two physicians. We're going to really touch on a summary of what they have found the most compelling of the presentations that have been presented here, but also questions about how some of this very important information gets translated back to the private practice when so many of the doctors attending this meeting are academic physicians and researchers. We're interested in finding out what happens to the private practice doctor where the majority of cancer patients are seen. And so I'm joined by Dr. Sasha Vukelja, who is a medical oncologist in Tyler, Texas at the Tyler Cancer Center, part of U.S. Oncology. You've been with us many times before, and welcome back.
Thank you. Thank you so much.
And we're also joined by a good colleague of yours and a friend of Vital Options, Jeffrey Hargis. Dr. Hargis is also a hematologist and an oncologist at the Kentucky Cancer Institute, assistant professor of medicine at the University of Louisville, obviously in Louisville, Kentucky. Hello, Dr. Hargis.
Hi, thank you. Thank you for having me.
Let's talk about how, for the doctors that don't necessarily attend, or for physicians that are getting older and hard to keep up as we move into this era of personalized medicine and molecular therapies and all these new technologies, the whole face of oncology is just rapidly changing.
Well, good question. I think we're very fortunate in the modern era in that in order to figure out in oncology what the correct thing to do for a patient is, we have the whole vast world of computers. We have the NCCN guidelines that are immediately available. We have computer programs like UpToDate. And I think what's special about our subspecialty compared to so many other subspecialties is there's a good camaraderie, and it's all the world's experts in oncology are typically available on a phone call away, and we'll call you back later in the afternoon. We would hope in the very special specialty that we have that when we see an individual patient that all of us, regardless of age or what meetings we've been able to attend, we'll make sure that we are providing the adequate care by tapping into one of those 3 or 4 quickly available resources. I think we also find that most of us now, and in fact it's going to be very rare to have a private practice medical oncologist, most of us are in groups of multiple physicians, and each individual physician has a particular niche. So you can find your colleague that does go to the appropriate subspecialty meetings, is running clinical trials in your practice in that particular disease. So those are all readily available. I think years ago we didn't have the computer access, much more difficult, but even without the computers, a phone call away to provide the care.
Well, I think it's got to becoming more and more challenging as the volume of advances is such that you all have to stay on top of an enormous amount of information, with patients also coming to you saying, I read this, what about this? And the amount of research that patients are doing on their own.
And that's true, and I think in a lot of the practice that I'm in, where I see most of the breast cancer, it's for that exact reason. It's that happened because my colleagues who want to provide consistent and very good high quality care realized that it was so very difficult to keep up with all the fine details and the continually moving amount of information in breast medical oncology that we needed one person that was sort of the go-to person that remained an expert. We're also very fortunate. What keeps most of us in private practice very sharp, in addition in individual subspecialties, is there's a huge ability to do clinical trials in private practice now. 10, 15 years ago, there would be typically at any given time 7 or 8 or 9 interesting and exciting clinical drugs in development. Now there's a couple hundred. The new and exciting drugs, there truly are almost not enough patients for all the drugs we have. So there's plenty of availability to have the most exciting and interesting and state-of-the-art medications, even in a private practice setting.
Well, again, you're unique because you're one of the private practice physicians that will actively participate and encourage clinical trials. For many of the private practices, because of the amount of paperwork and time and cost involved, it's more difficult. And that's why I like to encourage patients, get that second academic opinion, because for a trial that's far enough along in its research, you may be able to have your physician coordinate activities with the cancer center or the academic setting and collaborate, because we really also need to, the volume of patients willing to participate in clinical trials is relatively low in the adult population, but I think it's because they don't necessarily know about
Yes.
what's available.
And I think that's important, some, if I might say, to get second opinions. I think patients are getting more sophisticated, and to bring that information to the physician, and they could cut the traveling. And if there's a specific type of drug that they have to get in that institution, they can get the physical exam and the labs locally and still get the latest therapy that's available. So I think research is the key element here, that we have to, the only way we're going to conquer this disease, breast cancer, is by doing research.